For many, this is where life ends, under bright lights in a sterile, unfamiliar place.
They're busy places. They are not quiet places. They are not going to be environments where it's actually going to be optimal for the family and particularly the patient to die.
After almost 3 decades in intensive care, Dr Mitchell says she's never seen so many people coming through hospital doors.
The challenges that we face is that there have been very few conversations about what's going to be important to that patient as they near their end of life.
The common thread? A lack of planning and acceptance around death.
I probably can count on one hand how many times I have come across an advanced care plan. And once they're unconscious and I'm seeing them in the middle of a medical emergency, I have to seek information from the family member who's listed on the medical record. It's very hard for them to make that in-the-moment decision when they actually haven't been prepared for it.
Cheryl Moon waited too long to discuss her mum's end-of-life plan. June was 92 when she was admitted to Canberra Hospital. Her heart was failing.
It became obvious that she wasn't going to go home, and so the surgeon advised us to look for care for her. When we told Mum we were looking into aged care, she rolled over, and the next 10 days were about her leaving the world, I guess, under her own terms.
Cheryl wishes she'd spoken more openly with June about her health, believing it could have given them more time together during an already difficult period.
My son died 10 days before my mother, so working through the grief was on behalf of 2 people. There's a big expectation on people to be more aware of how to deal with lawyers or superannuation companies. That's just another complication of ensuring that the end-of-life process comes to an end. The grieving never does, but that the process does.
There's so much that we need to do in preparation for this life stage, and it's never going to be easy, but it can be a lot better.
Melissa Reeder runs Violet, an organisation that helps Aussies navigate life's final chapters.
In that last 12 months of life, people spend an average of 33 days in hospital. A large proportion of that is really non-beneficial. It also means that there is really significant cost bearing down on our healthcare systems. We are not providing enough support to help people have the experience they want and deserve.
Melissa has had first-hand experience of navigating grief. She lost her husband, Maro, to kidney cancer. At the time, her 3 children were all under 7.
We didn't talk about it. We didn't plan for it. He died in intensive care. He didn't want to be there. We didn't want him to be there. And, we didn't even have a will in place.
Melissa believes a guide to preparing for death, even if it feels premature, could ease the burden when the time comes, especially for those juggling work, kids, and the growing responsibility of caring for ageing parents.
We can advocate with the right agency and the right information, but also to help them make sure that they have their financial, legal and life matters in place.
Around 12,000 Australians turn 85 each year. By 2032, that number will soar to 60,000, a 5-fold increase. Dr Mitchell fears this ageing boom, paired with a culture that shies away from death, could place unprecedented strain on our healthcare system.
In the current environment, we're probably not going to be able to sustain what we're offering. And so either an enormous amount of dollars are going to have to be put into improving and increasing the amount of acute care. Or should we start to think, well, is all what we're doing actually in the patient or the community's best interest? Let's start talking about what our last chapter might look like.
Violet wants the federal government to back carers and fund groups that help families plan for the end of life.
If we can reduce preventable hospitalisations, particularly in the elderly frail, we can return billions of dollars and hundreds and hundreds, if not thousands, of hospital bed days to the system each year. Take a big breath and be brave enough to open some of these conversations with your parents, your in-laws, your partner, your family, about really a chapter of life.
Like many Australians, Mum believed that she would die at home in her own bed. But also, like many Australians, that isn't what happened for her.
We avoid it a lot, don't we?
Yeah. Why is that?
Because I don't want to have to think about it. Like even thinking, I'm kind of youngish now, but thinking about what would happen to my kids, it's just too overwhelming to imagine life without them.
Yeah.
Not that I'd be alive.
Yeah,
but do you know what I
But
mean?
you're also imagining them as young kids.
Yeah.
Whereas when they're adults, I think it's quite a different conversation. But I think there's something about we're a culture that avoids death generally because we like to build everything around, I don't know, fun and consumption, and that's just inimical to death. But I don't know if you feel, Susie, in Lebanese culture it's the same, but certainly in Egyptian culture, like death is not something you avoid talking about.
That's something that I didn't realise that everyone didn't talk about growing up. Like we used to buy funeral blacks as kids because we went to so many funerals when we were little, and that was just a thing that we did. Yeah, you went
Are
to.
you not scared of death?
I mean, I am, but like it's not something. Talking about death is not something I'm scared of, and I have had conversations with my parents. Probably not enough now that I look at the amount of admin that is involved and seeing those stats, but. I think culturally there are some big differences.
Yeah, understanding that life is built around an understanding of death, that changes everything. I think.
Yeah.